Hey, my name's Dr. Louis Mariuso. I've been doing dentistry for over 7 years now, and I'm located in Knoxville, Tennessee. Dental implants is the best thing that we have come up with to try and replace what we were naturally born with. It's as close as you can get to replacing your teeth in terms of aesthetics and in terms of function. A lot of times I like to say it's basically a man-made root. It's in the form of what you would consider a screw, but it's made out of a biocompatible material that your body adheres to that can fully restore somebody's smile, confidence. It could be just a single missing tooth. It could be several missing teeth with implant bridges. It could be a full set number of implants and different types of restorations. It is definitely a means to regain the function that one would lose if they were to lose a tooth. Something surprising about implants that most people wouldn't guess is that the process itself is relatively painless. A lot of people will avoid the dentist just because they don't like to see a white coat, or they just fear that they're going to experience pain in the chair or later on. A lot of times what an implant is going to do is take a patient who might actually be in pain because of a failing tooth, whether it be an infection or a broken tooth. With our protocol and our experience and our practice, it's a straightforward and relatively painless procedure that we do very often here. And most patients are really surprised to know and go through it and say, wow, that really was not as bad as I thought it would be. When we see them for their follow-up appointments, they like to say, I wish I would have done that sooner. We're very grateful to be able to provide really good experience for our patients. When we prepare a site for the implant, there's a lot of biology going on. It's not just foreign body that we're hoping works or doesn't work. So there's like decades of research that has gone into implants and perfecting implants and different iterations of the implants. And we're all made differently, slightly with different biology, but we all have bone cells. We all have nutrients in our blood. And when an implant is placed, we rely on the body's ability to heal and accept a foreign object. And with implants, we see a 95 to 97% success rate over 10 years, which in dentistry, it's as good as it gets. Those bone cells, they adhere with the implants to the titanium, and they fuse and they integrate to the body so that it becomes a part of you. We get to restore those implants with teeth. And ultimately, the patients, they don't come in looking for, I want one implant. They really, what they're trying to say is, I want to be able to smile again, I want to be able to eat again, and then it's our job to figure out what gets them there. And implants are definitely an amazing solution for being able to recover that. I think implants are the go-to solution for missing teeth because of the predictability that we have with implants. So they're as close as you can get to something feeling natural. If you had teeth for decades of life and then all of a sudden something happens and you've lost all your teeth, it's a big change to go from that to wearing dentures that may look nice but don't function well. It changes your entire quality of life. When we're talking about maybe a few teeth that are missing, one of the options for replacing missing teeth is a bridge as well, which can be a viable solution for certain patients in different circumstances. And that's one of the things about our practice is we're not a one size fits all. We have to take into account every single individual patient, their desires, what they're able to do and what they're able to have. Not everybody is a great candidate for implants, so maybe we have to consider a bridge. But when you're comparing apples to apples, it's definitely preferable if you're able to replace a missing tooth with an implant, just because of the predictability, the functionality, and as close as you can get to being natural. With a bridge, one of the downsides is that when you're replacing a missing tooth, you have to utilize the neighboring teeth to that space to support the false tooth that's going to be in the middle. And when that happens, you have to reshape the structure of those two teeth so that a ceramic bridge can be seated and cemented on them. And so if those teeth don't need any dentistry, there's no big cavities, there's no decay, it's not a great idea to go shave those teeth down, fill in the missing space. You're overdoing it. Whereas an implant would take care of the individual situation, which is a missing tooth. And not to get too complicated, but let's say you have, those two neighboring teeth need crowns. Maybe a bridge could be a viable option because you are going to need crowns there anyways. So If financially, maybe implants isn't something you're able to do, if biologically you don't have the bone, because we do lose bone over time, but you don't want to walk around with a gap and missing space in your mouth, a bridge can certainly be a good option as well. But like I said, everyone, we take each approach individually, delivered in a way that is going to be beneficial for each patient in whatever situation that they're in. The biggest myth about implants that I wish I could debunk is that they're invincible and they'll last forever. That is to a certain degree true, but like anything in life, if we don't take care of it properly or adequately, it can cause problems, right? If we're not following up regularly with the dentist with our hygienes, if we're not properly brushing the surfaces of the implant, if we're not properly flossing where we need to underneath the implant crown, if we're not using our water picks. When we have things and we invest in things, we want to make sure we take care of it. That includes making sure you're going to your dentist regularly to maintain, make sure you're keeping up good hygiene at home, make sure you're wearing a night guard when you go to sleep to protect your implant, your investment from those forces. It doesn't make sense to me why you would invest in something and then not take care of it. So implants are not invincible. Although they have a very good record, it does require maintenance and proper care. They are a little bit different than natural teeth. They have different sort of things that we need to keep in mind. Cleaning it properly is one of those things that you want to make sure you're doing.